You can use low-dose topical vaginal estrogen alongside your systemic HRT if you have vulval lichen sclerosis. This is safe, and actually it's vital that we think about low-dose topical vaginal estrogen for those coping with lichen sclerosis, and particularly if they are in the perimenopausal years or if you're breastfeeding and there's something known as genitourinary syndrome of lactation. The problem we have, as this paper pointed out, is whether alterations in the estrogen metabolism contributes to lichen sclerosis. That is still unclear. However, topical and systemic estrogens have been found to be beneficial in symptom reduction. Vulval lichen sclerosis is a lifelong inflammatory skin condition. There is a possible autoimmune link because if you have an autoimmune condition such as alopecia, vitiligo, thyroid, autoimmune disease, diabetes, Crohn's disease, or celiac disease, you're more likely to be affected by lichen sclerosis, although we have at the moment not termed it properly as an autoimmune condition, and we also think it possibly runs in families. Now, vulval lichen sclerosis can also be at other places on our bodies. It's a condition that does mainly affect the genital area, but you might want to look in your mouth because it can sometimes occur there. It's a condition that affects more women than men. Men can get it on their penile tissue. It's so important to know that lichen sclerosis isn't caused by an infection. It's not contagious and it can't spread through contact, including sexual contact. We think at the moment it's not related to allergies and it doesn't lower your immune system or affect internal organs. The symptoms of lichen sclerosis are covered on this free website called Lichen Sclerosis Guide. I really recommend that you have a look at it because it's got free evidence-based information on there. The youngest I've diagnosed with lichen sclerosis is 4 years old, and the symptoms are itching, painful sex, pain or soreness, burning, irritation around the vulval vaginal tissue, feeling of dryness, change in sensation, pain when you pee or poo. So it's so important to have a look at the anal tissue because lichen sclerosis does spread there, and disturbing stream when you wee. It could be a weak stream, but also painful when you pass urine. Some people with lichen sclerosis might not have any symptoms, so it's known as asymptomatic because it's a waxing and waning condition. So therefore, you might just see some visible signs, and these are the visible signs we're looking for. One of the most taboo things is noticing swelling, particularly around your clitoris, and architectural change around the vulvar and vaginal skin, particularly thinning of your labia and your lips. At the moment, using vulval moisturizers that suit you and also topical steroids are the only treatment that we have for managing lichen sclerosis. I hope that's been helpful.